If you have anxiety, but your child has not been to the dentist yet, please don't say that I'm going to take you to the dentist for a needle, which is something we use. You'll get a shot if you don't eat your food, if you don't do your homework. So that is a scaring technique by parents. Don't use that. Don't do that.
Dentistry is like other things that has been changed. I will just take a few things and try to compare between them. Which one is better, mercury fillings or white fillings, and why? Some people have the white coat syndrome. What are the solutions for people who just get scared to see the doctor, dentist especially?
Well, one way is don't wear a lab coat.
Okay, just take it out.
Just take it off. So that's one way, is just don't wear a lab coat.
Hi, this is Nora De Silva. My host today is Dr. Reem. She is a dentist. Hi, Dr. Reem. How are you doing?
I'm doing fine. Thank you very much.
Thank you so much for coming to my channel today and your willingness to share the information with us today.
My pleasure.
Dr. Reem, how often we should go to the dentist?
So the standard protocol in Canada is every 3 to 6 months, but it depends from person to person. The bare minimum is every 6 months.
How to maintain healthy gum and healthy tooth?
So back to the first question, every 3 to 6 months, again, for regular hygiene, professional hygiene, with your dentist and your hygienist, and then at-home care with toothbrushing, with brushing your teeth on a regular basis 2 to 3 times a day, flossing on a regular basis, and using mouthwash.
Perfect. Dentistry is like other things that has been changed. I will just take a few things and try to compare between them. So which one is better, mercury fillings or white fillings, and why?
So mercury fillings are called amalgam fillings, and they've been used for over 150 years in dentistry. White fillings are fairly newer than the amalgam fillings. However, which is better, it's really hard to say, because amalgams can withstand a lot of pressure. They can withstand a lot of functional forces, unlike composites. And what I always tell patients is they will stay standing, your amalgams will still be standing, and then the tooth around it will break down. In comparison, white fillings are the more acquainted ones, the more used ones in dentistry, just because they are more aesthetics, they are more durable now than when they first came out, of course, with advances in medical dental innovations when it comes to composite fillings. It is the preference, though, for 90% of patients. That's what they want, is white fillings.
The difference between the tooth crown in the past and the tooth crown in the current time?
So in the past, we used to use a lot of the metals, so like the heavy metals, the noble metals, like the silver, the gold, and the silver metal, the porcelain fused to silver. Nowadays, most dentists will use and go towards zirconia. They are durable, they are highly aesthetic, and then you can use them in the front and the back, and they're very highly aesthetic.
The difference between braces and Invisalign?
All right, so braces is the standard. That's where we learned all the biomechanics for the innovation of Invisalign. Braces is standard brackets and wires, and the brackets has the forces that are incorporated on the tooth that moves the tooth into their new position. What's the main difference is braces is ugly.
Okay, yeah.
Some people is not ugly.
No, some people even they get bullied when they used to wear braces.
Absolutely, that is very true. Yeah. However, I still have patients that come and ask me, can I get the braces? I want the train tracks, and I want to put colors.
Okay.
So because you have rubber bands that have different colors, and that's what a lot of kids want, that, but these are young kids, not when you're in your teens. Okay. Invisalign is, on the other hand, is very clear, so no one can see it. You move your teeth into a new position without anyone noticing your tooth movements, or that you have anything in your mouth. The main difference is you might lisp with Invisalign. With brackets and wires, you don't lisp because there's nothing impacting your tongue. Aesthetics is one factor. Another big factor is compliance. So with brackets and wires, the main compliance that comes from the patient is mainly cleaning your teeth, making sure everything is nice and clean, maintaining, if you have elastics, you're wearing your elastics. But with Invisalign, it's 100% on the patient. Everything is dependent on you. You put your aligners on, your teeth will move. You don't wear your aligners, your teeth are not moving anywhere.
Okay. Why the demand on Invisalign has increased?
So in the past 3 years, I would say, well, during COVID, the Zoom effect it was the era of the Zoom effect, which basically is when we started communicating with each other, because there is no face-to-face contact anymore, people started using their iPads, their phones, their computers to connect with other people through a Zoom call. And with that, I'm sure you have done it too, where you just look at yourself in the mirror and you look at your imperfections. So if you had crooked teeth, yellow teeth, that is the first thing that stands out. And usually, that is the first thing you're looking at, is when you're if you're talking on the phone, the first thing you see, because your teeth are usually whiter than the rest of your face, you're looking at your teeth. 100%. And when you talk, your lower teeth show. And if they're crooked, that's when you're going to go back. You're going to go and want to do something about it. So we had a lot of people come in and say, you know what, I want to fix this. Now this is bothering me. I've had it for all these years, but now it's bothering me because I see it. So what are other people seeing if I can see it when I'm talking on the camera?
Some people have the white coat syndrome. What are the solutions for people who just get scared to see the doctor, dentist especially?
Well, one way is don't wear a lab coat.
Okay. Just take it out?
Just take it off. So that's one way, is just don't wear a lab coat. But really, a lot of methods that have been implemented in the dental field is when you dress regular, so like with professional clothing, dress pants.
The blue 2 pieces it comes, or
the
black?
Scrubs. So now after COVID, we do a lot of scrubs because of infection contamination.
What does scrubs mean? And
so it's the uniform. Wow. It's basically the same uniform that nurses wear in the hospital, doctors wear in the hospitals. It's the same concept.
This is the same thing is being used over like back in our country in Iraq, the same method now, or they are still using the white coat?
No, mostly they dress up with dress pants. Okay. And then either a scrub top or shirt. Okay. It's easier for them there. Okay. Because they don't change. I have a lot of dental friends, and I don't see them changing. I know that they wear either a scrub top and a dress pants. It's easier that way. Yeah. But here we do like either you dress up and you wear scrubs on top, like a lab coat on top. Yeah. Or if there's a different mentality, is you wear scrubs. I prefer the scrubs because I don't have to think about what to wear in the morning. And this doesn't have to match this. Okay. And it has my name on it, so there's no name tag, so it's easier. Okay. It's easier to implement the scrubs rather than to wear your dress clothes, because then you run out of things to wear.
Okay, so this is one thing to do, is just to change the color of the cloth. Yeah. Yeah, and other things to do.
The other factors that we implement is different aromas in the office. Yeah. So aromatherapy, like diffusers in the office, music. Okay. So in our office we play. It depends on our mood. Okay. If I walk in the morning, it's usually very loud music that you go like this the whole time. But if the other girl, no, not rock and roll, but I play different kinds of genres. Okay. So if I'm picking the music playlist, but if the girls are picking it, they sometimes play jazz, traditional pop, something oldies, and we also take into consideration what kind of age group we have at the moment in the office. So if it's more of the elderly people, we take into consideration they don't like the current music styles. It has to be something more soothing for them. Yeah. We also have TVs in the office. We have incorporated TVs, so they are hung on the wall, and so that when the patient is laying back, they can watch TV easily. And they get to choose what kind of show they watch, or music, or we can just play some nice sceneries without any sound. These are the things that we're usually implementing in the office to help ease the patient. The one big thing that that all dentists need to make sure that they're doing is building rapport with the patient. So when you are connected with the patient and when you become close with the patient, it's easier for the patient to trust you and take into consideration what you're saying. For example, so we use the method of tell, show, and do, which is a method that's used mainly for kids, but you can also implement it for people who are anxious of the dentist. So I'll tell you what I'm gonna do, I'll show you, not in your mouth, but I'll show you what I'm gonna do, and then I'll do what I said I'm gonna do. Okay. And you have to follow these exact steps so that you can't show without telling. Yeah. You can't do without showing. Yeah. So that creates a different environment and a different connection with the patient, and then you break that you break that wall, that barrier. And usually patients who are really scared most likely have had a really bad experience as a child, or their parents have had a bad experience, so it just gets passed on.
Okay, so now we are on the same atmosphere. It's about getting scared from the dentist. We'll talk about kids. Kids are more scared to visit the dentist than the adults. What are the methods used nowadays to overcome those fears?
So one big thing that one of my professors used to do back in school is he would wear different colored shoes. So he would wear red and orange, or blue and green, or blue and red. And the first thing the child would look at is, because the dentist is walking in, they would look at their shoes.
To get them distracted. So
it's a distraction method. So one way is a distraction technique. You can use that, wear different shoes. I've tried it, it doesn't work with me. Okay. It was not comfortable. It gave me anxiety just looking at my shoes. Okay. So because I was not a match.
Okay, so this is no for you, not an option for you.
Not a good option for me. I bought two shoes, two pairs. One was orange, one was red, and I tried, and it gave me anxiety looking at my shoes. It didn't match my outfit.
We don't need you to get anxiety.
No. What I use in the office is I tell the patients, I need you to look up and look for the spaceship, but I whisper this in their ear so that the parents, and I tell the patient, this is a secret between me and you. No one knows. You gotta find it. Yeah. So they tilt their head back. I give the needle. I'm done. They are done. When they bring their head down, they ask, where is the spaceship? I can't find it. So that's one method. Another method would be also the TV. You play their favorite cartoon, their favorite TV show, their favorite YouTube channel. Never know. We might be both somebody's favorite.
Yeah. What about loot bags?
Loot bags, these are usually given at the end of the appointment. Yeah. What I also usually give is I modify the gloves that I usually ask for, like I would ask the child, what is your favorite animal? But I give them an option. They have 4 options to choose from. A pentapus, which is an octopus with only 5 legs, a cow or an elephant, a bunny, and a fish. So they have these 5 options to choose from, and then once they give the option, then I make the balloon at the end of the appointment, and I actually draw on it and take the time to draw on it and ask if it's a boy or a girl. If I have different colored gloves, I would ask what color they want. So that creates an excitement. Yes, it's an excitement. They're looking forward to the end. What are they gonna get? Yeah. The tell, show method, do again is very, very practical with children, because then you can tell them and show them and tell them exactly. We also change the words of the suction tube to Mr. Slurpee, or this is the fire hose, for the water spray. Nice. And then I can give them the opportunity to play with the fire hose, to use Mr. Slurpee. The hand pieces, the instruments that we use to drill, I give them a name. So I use, for the slow one, I use Lighting McQueen. What's the cars? Yeah. The car, the guy, the broken car.
Okay. I can't remember
Mater.
Now. Okay.
The broken truck, the one that takes this Lighting McQueen. Yeah. So you give them names. You connect with them based on their level, their world. So what cartoon do they like? Yeah. So you talk about the characters with them. When you go down to their level, then there's that trust. You can build that trust with them. Then they let you do whatever you need.
Yeah. Nice techniques. What are the cons and pros of tooth implants?
There are not many cons that I can think of, but the pros of dental implants is it is considered the gold standard of treatment for tooth replacement. Why is it the gold standard? Because then if you're missing one tooth, you just need one tooth that needs to be replaced, then you don't have to damage the adjacent teeth. So that's basically it. It really acts like your own natural tooth. The only difference is the amount of movement that takes place in a natural tooth is different from a dental implant. They've been around since 1965. So they're well studied, they're well known, they're used a lot nowadays. Cons, I can't really think of any cons. It is the gold standard. It is a better alternative to so many.
Okay. How many methods are there to whitening the teeth?
There are several methods. I can't name exactly how many, but there's an in-office whitening, which is you get it professionally done with in the dental office. It's usually an hour and a half to 2 hour session where you go through sessions of whitening. So you get the material applied, you let the laser light sit on it, and then it activates the chemicals, which whitens your teeth, and you go through sessions. Now, based on your sensitivity, tooth sensitivity, you can go all the way to 4 sessions. Some people stop at 2. I personally stopped at 2. I've had patients who stop at 3 sessions and they say, I can't handle it. It's very sensitive. There is a take-home whitening, which is basically you take an impression and you get a tray, you apply the gel and you put on the tray, and you allow the whitening to kind of work on at home. Does
this kit as well rotate the tooth, like give it sensitivity as well?
Sensitivity is normal after whitening.
Okay.
It is something that
a part of the procedure.
It's an inevitable condition that you get. Now, does everybody get it? Not everybody, but most people do end up with sensitivity. So the treatment for that is to use a desensitizing toothpaste, so anything for sensitive teeth. An alternative method is there's the whitening strips that you can get over the counter. There is like a lipstick that you apply. It's a gel, looks like a lipstick, and you apply it on your tooth. Right now there is the purple toothpaste that you brush your teeth with, you leave it on for 3 minutes, and then you rinse your mouth. Does it work? It has worked on some people. I personally have a family member, they've tried it, it doesn't work. So it really depends on your tooth itself. Is there staining on your teeth? What is the cause of the stain? Is it something that you were born with, or is it something that's external? So whitening will work on external stains, not internal stains. So, and there's within the tooth whitening as well, which is also done professionally.
How to maintain the white teeth?
So after you've done your whitening, or just in general? So after you've done your whitening. So anything that has color in it. So your wine, your tea, your black coffee, your black tea, red wine, pasta, mustard, all of these that have food coloring in it or that has color in it will automatically stain your teeth. So maintenance is basically making sure that before you do the whitening, you have a professional cleaning done so that there's no plaque or buildup on your teeth. After that, minimizing the amount of consumption of these extrinsically staining foods, such as tea, black coffee. For example, if you like to drink a lot of tea, rinse your mouth with water after you're done. So, and if you like to drink your coffee, add milk to it. It's not going to eliminate it completely, eliminate the staining effect, but it's going to reduce it a little bit. It reduces the amount, the milk and the cream, and it will reduce the amount of staining it causes. The other thing that you have to make sure that you're doing is after you're done, at the end of the day, make sure you're brushing your tongue, because residues will stay on your tongue and they can also stain your teeth. Smoking also causes staining. So all of these factors, whenever you eat something that has high color in it, coffee, tea, red wine, make sure that the bare minimum is rinse your mouth with water.
Nice. The question is that comes to my mind now: how often we can do the whitening through laser? Like, can we do it like twice a year?
You can. It is a long process, and it depends on how you maintain your teeth. Now, a lot of people will do it like once a year, once every 18 months. Why that duration? Because if you maintain and you cut down on your consumption of, for example, if you're a heavy red wine drinker and you've gone through the discomfort, not pain, the discomfort of getting your teeth whitened, you're going to want to maintain it for as long as possible. So you're going to cut down your consumption of red wine. Possible. Not necessarily going to happen. So it all depends on care again, it all falls down onto care and how well you take care of your teeth after. Do you brush on a regular basis? Do you floss on a regular basis? Are you rinsing your mouth with water, the bare minimum, after you've consumed something that has coloration in it? Are you brushing your tongue? Are you going regularly for dental checkups and cleaning? When you get your cleanings done with the hygienist, they do their polishing. The polishing will maintain what you've already started. Now, another thing to add on to that is when you do your professional whitening, in-office Zoom whitening, you can also get the take-home whitening kit, so it helps you maintain everything at nighttime, which basically has a minor concentration of the whitening material. You place it on at night for 5 minutes, and that keeps your teeth whiter and brighter.
Thank you so much, Dr. Reem. I am done with my questions, but the time just flies by so quick with you. I had so much fun listening to the information, and thank you so much for coming today to my channel, and I will interview you again. This is not the last one, for sure.
Thank you so much for having me.
Thank you so much. I hope, guys, you have enjoyed the interview with Dr. Reem and you make use of all the information she mentioned. Stay tuned for more episodes and more new information to come up. This is Noor De Silva.